Well, as we approach the third year of living with the coronavirus, COVID-19 cases are ticking up again in our area. Now there is a new variant that is quickly becoming the dominant strain throughout the Northeast. So how concerned should we be about this new COVID-19 variant? We asked Dr. Daniel Varga to update us. He's the Chief Physician Executive at Hackensack Meridian Health in New Jersey and one of the medical experts we have been consulting with since early in the pandemic. Dr. Varga, good to see you again.
Morning. Glad to be with you.
So is this the holiday spike that we were warned about before Christmas? Seems everybody either has COVID or knows someone who has COVID right now.
Sure looks like it, doesn't it? The interesting thing is the numbers are certainly up. Kind of around a couple thousand, 2,500 cases a day. Good news is that's not anywhere close to where we were a year ago. But yeah, this is looking like the post-holiday spike.
Talk about how contagious this new variant is that's making up most of the cases in the area. Where do you rank this one?
You know, it's a very contagious virus, so it's easy to catch. The good news is when we look at severity and acuity across the state, it's kind of like the other Omicron variants. I mean, you can get sick, but it's not causing nearly the amount of hospitalization that we saw with Delta. A year and a half, 2 years ago, not nearly the amount of ICU. I mean, we're seeing probably about 10, 11% of the people that get hospitalized have to go to the ICU, 4 or 5% of the people that get admitted to the hospital having to be on a ventilator. So, I mean, it seems to be about the same severity as the other Omicron variants, which is a lower level of severity, but it's really contagious. It's really easy to catch.
So what do you tell people that are out there now? This is year 3. It's so hard to believe. It's hard to even fathom. We're saying this is 3 years that we've been dealing with this right now. But because it is so contagious, it's yet another variant. Is it one of those things where people just have to, whether you've been vaccinated or not, just kind of, you're going to get this thing, and hopefully you're not going to get it with the severity that people got it when we first started talking about this pandemic?
Yes. So first of all, the bivalent vaccine, so the newest booster, really works well at preventing severe illness, even against the XBB variant. So again, shots in arms is still a really, really good thing. And I think, kind of the basic common sense, some of your other commentators have actually raised this as well. Look, if you're feeling badly, don't go to work. If you have COVID, isolate yourself until you're no longer symptomatic. If you have to be around somebody who has COVID, wear your N95 mask, wash your hands. I think again, this is still a spectrum of risk, right?
Yeah.
The outside's better than inside. Smaller crowds are better than big crowds. Mask versus not mask. All of those are helpful. And the good news is that, again, this isn't a variant that's causing a lot of death or hospitalization relative to others. And we just have to kind of hunker down and get through it. Yeah.
As far as, I know you mentioned the vaccine a second ago, so we're still recommending people, if you're due for that booster, go out and get it. Better the ounce of prevention, right? We're at the pound of cure.
Absolutely, absolutely. And just remember that there is treatment for this as well. The big deal with the monoclonal antibodies not necessarily working against the XBB, but remdesivir and Paxlovid both work in terms of shortening duration of symptoms and making people feel better.
Several drug manufacturers are working on new treatments, possibly new vaccines that can be taken by nose or by mouth. Is there anything that you can tell us about that or what we can expect down the line?
So those are early stage trials, and I know that a lot of those are now going into more advanced stage trials, testing them on humans and seeing whether they work. The question around COVID is, are we going to keep chasing variants? This has been a very adaptable virus and kind of very different than the way we've dealt with flu, which is we can look back at what caused the flu outbreak from the previous year, look at all the different serotypes that you have there, and then build a vaccine for that because it's not mutating every 6 months like COVID is. So that'll be the real question about whether or not we keep chasing variants or whether we're able to land on a more, kind of stable and predictable vaccine.
A lot of question marks, right? A lot of balls in the air still.
A lot of questions.
Yeah, okay. Well, Doc, great to talk with you once again. Thanks so much, and we appreciate you checking in with us.
Thanks for having us.
That's Dr. Daniel Varga, who is the Chief Physician Executive at Hackensack Meridian Healthcare, and we will be right back.